Welcome back to the Deep Dive. Today we're embarking on a really fascinating journey into equine health. We're focusing on a condition that can look, well, incredibly startling. It often leaves horse owners just completely puzzled. Equine Stringhalt. Imagine a horse suddenly, dramatically lifting its hind leg. Sometimes it's so high it almost touches its belly before, bam, slamming it back down. It's a movement disorder, yeah. Dramatic and, for a long time, pretty mysterious. So our mission today is to unpack everything we know about Stringhalt. From its kind of bewildering causes, how it's diagnosed, treated, and what the future holds for these horses. Think of this as your shortcut to understanding a really complex equine health challenge. We're pulling out the most important facts, trying to give you those aha moments.
Yeah, and it really is a condition of remarkable duality. While Stringhalt looks similar outwardly, these striking signs, it actually has two very distinct forms, different origins, and crucially different prognosis. Understanding these differences is absolutely key. It's fundamental to managing the condition effectively. A great example of how intricate these neuromuscular disorders can be.
Okay, so let's start with the basics then. What exactly is equine Stringhalt? Sometimes called Springhalt or equine reflex hypertonia. Yeah. At its core, it's an involuntary exaggerated flexion, one or both hind limbs, during movement. If you're picturing a horse trying to walk and suddenly its hoof just springs up uncontrollably, maybe even knocking into itself, you're on the right track.
Definitely.
And the signs, they can vary wildly, right? From subtle to really quite dramatic. We've seen everything from just a mild sort of spasmodic lift when backing up or stopping, all the way to extreme cases. The hoof can actually hit the abdomen, the thorax, sometimes even the elbow, which leads to this really peculiar gait, almost like bunny hopping or maybe goose stepping. Try explaining that one. And while the lateral digital extensor muscle is the main one affected, the whole hind limb gets involved because of something called the reciprocal apparatus. It's like if one part's off, the whole movement is affected. And in severe cases, even the forelimbs can show issues, intermittent hypertonia, stumbling.
Right. And it's important to clarify the impact here for you. While Stringhalt is technically an unsoundness, it affects movement. It's generally not considered painful, not in its primary form anyway. But you can imagine those severe cases with that extreme flexion and then the leg slamming down, that can certainly lead to secondary lameness just from the concussive forces.
Makes sense.
The severity truly runs the gamut, a mild hitch in the step to severe goose stepping. Vets actually use a standardized grading system to be objective, though we won't dive into the grades today. What's critical to remember, though, is that it's a neuromuscular dysfunction. Nerves and muscles aren't communicating right. It's not primarily a pain response.
Okay, that distinction is key then.
Absolutely, it shapes the whole approach.
Okay, when I first started digging into this, what really struck me was learning there weren't just one, but two totally distinct types. We've talked about what it looks like, but here's where it gets really interesting, the why. So first up, we have plant-associated Stringhalt, also known as Australian Stringhalt.
That's the one people often hear about first.
Exactly. And this form occurs in clear outbreaks.
Yeah.
Multiple horses, same time, often with a distinct seasonal pattern, late summer, early autumn. Most recognized in Australia, obviously, but also reported elsewhere. New Zealand, North America, Chile, Japan.
Yeah. It pops up globally.
And the surprising cause, specific toxic plants. The main culprit is Hypocaris radicata flatweed, cat's ear, false dandelion.
Common pasture weed.
Yeah, but also the common dandelion, Taraxacum officinale, and cheeseweed or mallowweed, Malva parviflora, have been linked. Now, why do these plants become toxic? Often it's environmental stress. Drier summers, drought-stressed pastures, poor quality grazing.
Right, the stress changes the plant's chemistry somehow.
Exactly. It induces the plants, especially that flatweed, to produce or concentrate these toxic metabolites. Horses then eat them because, well, there's not much else. And interestingly, older, taller horses seem predisposed, and cases are often more severe than the other type.
That's an interesting observation, yeah.
And here's a really intriguing bit. The symptoms might not show up for 1 to 3 weeks after the horse starts eating this stuff. There's a delay.
Which can make pinpointing the cause tricky sometimes, and delving a bit deeper into how these toxins work. Australian Stringhalt is what we call a distal axonopathy.
Okay, break that down.
It means the damage is to the furthest parts of the peripheral nerves. Think of nerves like long wires. The damage is at the very ends. It results in selective loss of the large myelinated nerve fibers, the well-insulated, fast-conducting ones, and some demyelination, loss of that insulation. The sciatic nerve, being the longest nerve, is particularly susceptible. That directly explains the hind limb signs.
Okay.
Longest nerve, most likely to be affected at the far end.
Precisely. And crucially, for you listening, there's no reported involvement of the brain or spinal cord, no central nervous system damage.
That sounds like good news, relatively speaking.
It generally is. It implies a more favorable prognosis for recovery once the toxin is removed because the control center isn't hit. But these toxins can affect other long nerves too, like the recurrent laryngeal nerve. That can lead to laryngeal paralysis, roaring.
So you might see gait problems and breathing noise.
You could, yeah. Australian Stringhalt often hits both hind limbs, though maybe unevenly, and severe cases might even show some forelimb or neck signs.
Okay, so that's Australian Stringhalt plants, outbreaks, distal axonopathy, no CNS. Now let's switch gears. The second type, sporadic Stringhalt, also called classical or the keyword idiopathic Stringhalt.
Idiopathic meaning we don't really know the cause.
Exactly. This form occurs worldwide, but usually affects just one hind limb unilateral, and it appears as isolated cases, not outbreaks. And yeah, the biggest mystery, the cause is largely unknown, hence idiopathic. But we have seen associations. It can pop up after an injury or trauma, hind limb, back, neck. Specifically, old wounds on the front of the cannon bone involving extensor tendons, scarring there. Has been linked. I've heard owners say it just seemed to start after a horse, tweak something.
Anecdotally, yes.
And it can also be secondary to other underlying neuroconditions like EPM or EMND.
Right, equine protozoal, myeloencephalitis, or equine motor neuron disease.
Or even orthopedic stuff like hock arthritis or maybe a hoof abscess, though the link there is less clear.
Right. So even without a definite cause, what do we know about the neurology of classical Stringhalt? Well, postmortem studies do identify lesions in the peripheral nervous system. Sciatic, peroneal, tibial nerves again. One leading hypothesis involves proprioception, the horse's sense of body position, a disruption in the nerve signals coming from sensors in the muscles and tendons, the Golgi tendon organs and muscle spindles.
The horse's internal GPS, basically.
Kind of, yeah. If that info is scrambled, it could lead to imbalanced muscle recruitment, muscles firing wrongly, causing that exaggerated flexion. Some studies have also noted abnormalities way up in the thalamus in the brain and reduced nerve conduction speed in the hind limbs.
So maybe some central component in some cases.
Possibly. It's complex.
Yeah.
But what's really notable is that, unlike Australian Stringhalt, postmortems in some severe classical cases show no clear evidence of damage in the central nervous system or the motor unit.
Which makes it even harder to pin down.
Exactly.
Well,
Much
yeah.
more challenging.
Okay, we've covered a lot on the two types. Let's boil it down. For you listening, what's the simplest way to keep them straight? The must-know differences.
Great question. Let's make it crystal clear. Key differentiators. Occurrence. Australian is outbreaks, often bilateral. Classical is isolated cases, usually unilateral.
Got it. Outbreaks versus single horse.
Cause. Australian is toxic plants. Classical is unknown, maybe trauma-related.
Plants versus mystery.
Neuropathology. Australian is distal axonopathy, no CNS. Classical involves peripheral nerve lesions, sometimes with no obvious CNS changes found.
Okay.
Associated signs. Australian might have roaring or muscle wasting. Classical is usually just the gait.
Just the leg thing.
Onset. Australian is 1-3 weeks post-exposure. Classical can be sudden, maybe delayed months after an injury. And finally, prognosis. Australian often favorable with recovery after removal from pasture. Classical, often persistent, may need surgery, prognosis more guarded.
That's super helpful. So this differentiation isn't just academic, right? It really matters for what happens next.
Absolutely critical. Misidentifying the type. You could end up with totally ineffective treatments. Trying surgery for the plant-based form, for example, would be pointless.
Right. It directly impacts diagnosis, treatment, the whole outlook.
It's the first vital step, understanding which path you're likely on.
Okay, so with all that in mind, how do vets actually figure it out? Diagnose Stringhalt. Starts with careful observation, I assume.
Yeah, the cornerstone is that clinical exam and a detailed history. Watching the horse move forward, backing up, turning. Signs can be worse with excitement, cold, hard exercise, stress. So observing in different conditions helps.
Context matters.
And the history is vital. For Australian, grazing environment, drought, those specific weeds present. For classical, any prior injuries, trauma, other neurosigns.
Exactly. Stringhalt is fundamentally a clinical diagnosis, often recognized by a skilled eye watching that characteristic gait. But a full lameness exam is crucial. You have to rule out things that can mimic Stringhalt.
Things like shivers can look very similar when backing up. Fibrotic myopathy, Upward fixation of the patella, even a hoof abscess or bad arthritis could cause weird hind limb movement.
So rule out the more common stuff first.
Precisely. Maybe even EPSSM, polysaccharide storage myopathy, with a muscle biopsy if the gait looks like shivers. It helps confirm it's truly neuromuscular, not just pain from something else. Helps zero in.
And imaging. X-rays, ultrasound. Their main role is to exclude other orthopedic causes. Bone chips, arthritis, soft tissue injury, things like that. They don't directly diagnose Stringhalt itself because it's nerves and muscles, not something you typically see on an X-ray. They help rule out what it's not.
Right. This is where the neurophysiological tests can be really useful. EMG, electromyography, and NCV, nerve conduction velocity studies.
How does that help?
They give objective evidence of nerve and muscle dysfunction. EMG measures electrical activity in muscles. It can show patterns of denervation muscles not getting proper nerve signals. NCV studies, especially testing the deep peroneal nerve in Australian Stringhalt, directly measure how fast the nerve signal travels. If it's slow, that confirms the nerve damage, that distal axonopathy.
So proof of nerve problems.
Exactly. Really valuable for ambiguous cases, for monitoring, for research, but maybe not always needed if the clinical picture is clear.
What about blood work? Usually normal. And critically, there's no specific blood test for the toxin causing Australian Stringhalt. We haven't definitively identified it yet.
Still a mystery toxin.
Yeah. You might sometimes see low vitamin E or slightly elevated muscle or liver enzymes in pasture cases, but it's not diagnostic. Then there are nerve and muscle biopsies. More invasive, obviously.
But they offer definitive pathological confirmation. You can actually see the axonal degeneration, the demyelination, muscle atrophy under the microscope. Pivotal for research in complex cases. So pulling it together, the diagnostic approach is strategic. Clinical observation first. Then maybe lameness exam to rule things out. Advanced diagnostics like EMG-NCV or biopsy are complementary, used for clarity or confirmation. It's often a diagnosis of exclusion.
Methodically ruling things out until Stringhalt is the most likely answer.
Pretty much, yeah.
Okay, diagnosis done. What can actually be done? Treatment. Highly individualized, you said, depending on type and severity. For Australian Stringhalt, the approach seems clear. Primary treatment, get the horse off the affected pasture. Immediately. Completely.
That is the single most critical, most effective intervention. Cannot stress that enough.
Then provide clean forage, good quality hay, supportive care, clean water, and nutritional support is often recommended. Thiamine, vitamin B1, antioxidants like E and C, maybe magnesium.
Yes, often adjunctively. Thiamine and antioxidants might help mitigate nerve damage or oxidative stress. Magnesium maybe helps early on, but not a direct cure. The main thing is removing the source.
Right. Get them off the toxic plants. That's job one.
Absolutely. Remove the cause of the nerve damage. Now, for classical Stringhalt, it's different. More challenging, often, because the cause is unknown. Pharmacological options, muscle relaxants like methocarbamol, mifenesin, baclofen, they've been tried. Often poor results in the Australian form and mostly just temporary symptomatic relief in classical.
So not usually a fix.
Not usually. Phenytoin, though, seems more promising. Anecdotally, it's considered the consistently most effective medication for Stringhalt. It works by suppressing excessive nerve stimulation.
Okay, phenytoin is one to remember.
It can help manage the signs. Tranquilizers like acepromazine might also help, mainly by reducing anxiety, which can make the signs worse.
And surgery, you mentioned that for classical.
Yes, primarily for chronic, severe cases of classical Stringhalt that haven't responded to medication. The procedure is a lateral digital extensor tenectomy. Cutting the lateral extensor tendon, sometimes removing a piece of the muscle too.
Which tendon is that again?
Runs down the outside of the lower hind leg. Helps lift and extend the hoof. The idea is to mechanically disrupt that exaggerated snapping reflex by loosening that part of the system.
Does it work?
Outcomes are variable. Success isn't consistently high. If it helps, improvement might take weeks, but it's definitely not guaranteed for every horse.
So a gamble, potentially?
A calculated one in specific cases.
What about newer things? I read about botulinum, toxin, BOL-NT.
Botox.
Yes, that's being explored. Botox works by reducing electrical signals in muscles, blocking acetylcholine release, causes temporary muscle relaxation.
How does that help Stringhalt?
Preliminary studies suggest injecting it into affected muscles can reduce the frequency and severity of the hyperflexing strides, offers targeted symptomatic relief. It's considered safe for joint injections in horses, so muscle injection seems feasible.
So not a cure, but maybe helps manage the signs locally. Exactly. Symptomatic management. So to summarize treatment, the choice really hinges on the Stringhalt type. Pasture removal is paramount for Australian. Classical often involves trial and error with meds, like phenytoin, or potentially surgery in tough cases. Many treatments offer symptomatic relief rather than a true cure, highlighting just how complex that underlying nerve damage can be.
Okay, so once a horse has Stringhalt, what's the long-term outlook, and can we prevent it? Prognosis, you said, is highly variable, depends on the form. For Australian Stringhalt, generally more favorable, right, especially if they get off the pasture quickly.
Yeah.
Many achieve functional recovery.
Yes, the potential for recovery is much better.
But recovery timelines can be long, typically 6 to 18 months, sometimes faster for mild cases, maybe 2-3 months. But severe cases can take over 2 years.
That's right. It takes time for those damaged nerves to potentially regenerate or for the horse to adapt. Patience is key.
And for classical Stringhalt, more guarded prognosis.
Often, yes. Cases can be persistent. They might get worse before they stabilize, and they often don't resolve spontaneously.
If surgery is done, improvement might take 2-3 weeks, you said, but still not guaranteed.
Correct. It's less predictable. And it's important for you to understand what recovery really means here. It might be a functional adaptation. The horse learns to compensate. They might be sound for pleasure riding, but maybe subtle gait issues remain.
So maybe not back to high-level competition.
Potentially not, especially in disciplines like dressage where perfect movement is key. But many can return to some level of work. Sadly, in severe, unresponsive cases, euthanasia is sometimes considered. It's a tough reality.
And relapses can happen.
They can, yeah.
Yeah.
Especially if there's re-exposure to toxic plants for the Australian form. Ongoing monitoring is important.
Okay, so how about prevention? Can we stop this from happening? For Australian Stringhalt, prevention is achievable. That's good news.
Definitely.
It sounds like it comes down to pasture management. Identify and manage those toxic weeds, flatweed, dandelion, mallow. Provide plenty of good, clean forage, especially during drought, so they aren't tempted by weeds.
Right. Reduce exposure, reduce consumption.
And maybe quarantine new horses for 10 days to 2 weeks to avoid introducing new weed seeds.
Yeah.
Smart.
Vigilance is definitely key for pasture management.
But for classical Stringhalt,
Here's the stark reality. There is no way to prevent the idiopathic form because we don't know the exact cause.
wow, that really highlights a gap in our understanding.
It absolutely does. Prevention is limited to just general good care, prompt attention to hind limb injuries, especially those involving extensor tendons, since trauma might be a factor.
So it really underscores the need for more research into classical Stringhalt.
Definitely. We need to understand the underlying cause to even think about prevention.
And that brings us towards the end of our deep dive on equine Stringhalt. We've covered a lot. A complex neuromuscular disorder, that dramatic hind limb flexion, but with that fascinating dual nature. One type linked to specific toxic plants, the other often, well, a frustrating mystery. And it's so clear that telling those two apart, differentiating them, is absolutely critical for managing it effectively, for giving horses the best chance.
It really is quite remarkable, isn't it, how intricate animal health can be, and how even when we don't have all the answers, science keeps moving forward. This deep dive shows that. And it raises an interesting question maybe for you to think about. Given this ongoing mystery of classical Stringhalt, what other conditions out there, seemingly idiopathic in animals or even in us humans, might actually be linked to subtle environmental things we haven't spotted yet, or previously unrecognized physiological disruptions? Something to ponder, perhaps.
Definitely food for thought. Thank you for joining us on this deep dive. We'll catch you next time.